So today we will discuss regarding the protective layers and the coverings of the central nervous system. So the brain is protected by cranial bones and cranial meninges. So cranial meninges are surround the brain and they are continuous with the spinal meninges, have the same basic structure and bear the same names. So from outward to inward, so there are three layers. So first one is, so very close attachment is first layer, that is pia matter. So second one is from inward to outward, that is arachnoid matter, and the most outer layer is dura matter. I have already explained you the brain is protected by eight layers, or eight protective layers are there. So the most outward layer is skin, second one is connective tissue layer, third one is areolar tissue, loose areolar tissue, and pericranium. So these five layers forms the scalp. So next to scalp is the skull bone, or it is the pericranial. So under the skull bone there are three layers which protects the brains. Those are dura mater, arachnoid matter, and the pia matter. So what are the basic, so now the basic, very basic question is, what are the meninges of the spine, CNS? So there are three connective tissue membranes that surrounds the brain and the spinal cord. So brain and the spinal cord, those are, so from inward to outward, so those are cranial meninges. So inward first layer is pia mater. So pia mater is highly vascular in nature, means it is having a rich blood supply, and it is very delicate membrane which closely covers the CNS. Which closely covers the CNS means even it invaginates inside the brain or cerebral cortex. So it is closely investing on the surface of the cerebral cortex. So coming to the second layer, this is the general introduction of these three layers. So in later classes we will deal, so what are the structure, or what are the folds of dura mater and arachnoid matter, and what are the spaces. So what is arachnoid matter? Arachnoid matter is a delicate membrane and which is non-vascular, or it is relatively avascular membrane between the dura mater and the pia mater. So and next layer is the outward layer, that is very tough in nature, the tough outer layer of the meninges, made up of dense connective tissue. So this connective tissue is, sometimes it is serous in nature, sometimes it is fibrous in nature, hence it is fibroserous layer. So now we will discuss regarding the outer layer, that is dura mater. As we know, dura means tough and matter means mother. A layer which protects like a mother, that is a dense layer which protects like a mother, the two very delicate organs like brain and spinal cord, hence this layer is called as dura mater. And dura mater is, so it has got same name for even cranial meninges and the spinal meninges which are protecting the spinal cord. So in this picture we can see this is the table of the skull bone. This layer is the table of a skull bone. So next to the skull bone, the dura mater is present. So dura mater is made up of two layers. So one is pericranial layer or end osteal layer. Osteum means bone. So the layer which very close to the skull bone is called as endosteal layer, or peri means around, so around the bone, cranial means which is related to the head. So pericranial layer are the endosteal layer, so which is very close to the table of the skull bone. Again, the second layer of the dura mater is the meningeal layer. So that is outward endosteal layer or pericranial layer, and an inner meningeal layer or the meningeal layer. So meningeal layer. So usually what happens, there is no space in between these two layers, that is endosteal layer and the pericranial layer. There is no space in between these two layers naturally, but in some of the places these two layers naturally separate from each other. Naturally these two layers separate from each other and forms a space. Okay, you can see in this picture forms a space, and this layer is lined by endothelium. Okay, this space is lined by endothelium. Okay, so usually what happens, the venous blood is drained through this area, and this area is called as, usually this area is called as dural venous sinus. So the space in between, which is naturally created in some of the areas of the two layers of the dura mater, so which is lined by endothelium, and this is, this space is called as dural venous sinuses. So dural venous sinuses in between the two layers of the dura mater. So usually the meningeal layers, so these dural matter meningeal layers forms a four folds which divide the cranial cavity. So which forms the, so this is, I'll show you in the picture. So this is, imagine this is a skull bone, and in the middle there is a cribriform plate, and so suppose this is, and this is your nose, and this is the ear. Okay, so this is the cribriform plate, so where your pituitary gland is situated. This is the anterior cranial fossa, and this is middle cranial fossa, and this is posterior cranial fossa. So what we told, the meningeal layer forms the four folds which divide the cranial cavity. This is the anterior and this is the posterior. So the dural folds which divide the cranial cavity into the intercommunicating compartments for different parts of the brain. Intercommunicating compartments for the different parts of the brain. So usually in commonly we say, so you should not hit near the ear. So what happens usually, so the vessels which are present near the ear, so that is the mainly the branches of middle meningeal artery, so which is present near the ear. So in this area, so above portion is protected by the ethmoidal part of the parietal bone and the temporal bone. So this is the weakest area near the ear. That's why usually it says you should not blow or hit to the ears. So to continue with the class, usually dural layer doesn't have any space in between the two layers. These are very closely attached with each other. Still, it some pathological condition, it creates this space in between the two layers. Those spaces are called as potential spaces. Usually there is no space in between these two layers, but in some pathological condition, means in some disease condition, these two layers develops a space in between these two are called as potential spaces. So before moving to the further, so we need to understand there are different pathological condition whenever a person meets road traffic accidents. So you need to understand what is epidural epidural space. So second one is subdural space. So what is the meaning of epidural space? The space in between the skull bone and the periosteal layer is called as the epidural space. So now we will discuss how to define epidural space. So usually epidural space means we come to know, so it is the space in between the cranial, that is skull bone, and the periosteal layer or endosteal layer. So cranial epidural space is a potential space. It contains meningeal vessels. The spinal epidural space contains fatty areolar tissues and venous plexuses. What is the meaning of it? So it contains, that is, in between these two, that is bone and the periosteal layer, there may be a potential space. Usually it is adhered to the skull bone, but still it having some space. That space is called as potential space. It contains what? Meningeal vessels. So while describing, I have told, while discussing this, so this is the cribriform plate, so where pituitary gland is situated, and this is the foramen magnum. This foramen or opening is called as foramen magnum. So where spinal cord moves outward from the cranial cavity. So I told there is a potential space in between the epidural space. So here there is a foramen called as foramen spinosum, from where a middle meningeal artery traverses through the groove of skull bone. So it has got two branches, that is, one is anterior branch and second one is the posterior branch. So we come to know, in between the cranial plate and the periosteal layer there is a potential space which contains meningeal vessels. So this is the only reason why you should not blow or hit over the hit over or near the ear. So what happens whenever there is a injury to this area? There may be there are two vessels. So that is, this is meningeal vein and this is meningeal artery. So and I told the meningeal artery has got two branches, anterior and posterior. Whenever there is a injury to this area, so nearby this area, there may be the chances of rupture of the vessels. So it leads to hematoma or hemorrhage. Hematoma means it's a blood clot or collection of blood in that area, and hemorrhage means there is a bleeding. So this forms some of the pathological conditions, so that we will discuss in the next class. So continue with the class. So again we come to know what is the epidural space and what are the potential space and which vessels are present in that area. So next space is in between the, that is, so next space is, so below the dural folds, that layer space is called as subdural space. So how to define it and what are the structure in it? In the cranium, it is traversed by a superior cerebral veins, and in the vertebral canal It is a just potential space and of no clinical significance. In the cranial area, it contains some of the vessels which are superior cerebral veins. But in the spinal cord, there is that too in the vertebrae, there is no clinical significance in it. The space just below the dural meninges is called as subdural space. And one more space is there, that is subarachnoid space. So, what is the meaning of subarachnoid space? Sub means always below, and next to the dura matter is the arachnoid matter. So, you can see in this picture. So, there are the spider web like structure. So, those are called as the structures trabeculae of the arachnoid matters. Okay, so this layer and this layer, there is a space in between the dural and the arachnoid matter is subdural space, and the space in between the arachnoid matter and the pia matter is called as subarachnoid space. So it lies between the pia matter and the arachnoid matter. It terminates at the level of S2 vertebrae. So it ends at the level of S2 vertebrae. So I am stressing these spaces, just we'll discuss. So what are the pathological conditions and how to identify these injuries. So whenever there is a injury to the skull bone, so this is the plate of skull bone and this is the dural space. Suppose whenever there is a injury and these are the vessels which are present in the potential space of the meningeal layers of the duramater. So whenever there is an injury and this is the suture of the skull bone, so whenever there is an injury, so there may be the chances of breakage of these arteries which are present. So those are the branches of middle meningeal artery. So there may be the collection of blood in between the skull bone and the periosteal layer, that is in between the skull bone and the periosteal layer. So there may be biconvex collection. So this biconvex collection is there. So biconvex means just like an idli, so on either side there is a convexity. So this usually extends from the suture of either side of the skull bone and which will not extend more than these sutures. So then you can identify easily this is epidural hemorrhage. Okay, so this is how you are going to identify epidural hemorrhage. So sometimes what happens whenever person met and road traffic accident, there is an injury to the head. Okay, after few hours or few minutes, patient will become all right and he may get consciousness. So that is a transient period. Sometimes what happens without any hints, patient may lose conscience after several hours. So what it means, there may be the hemorrhage which causes the bleeding and it is not recognized. So patient is quite alright in that period. So that interval is called as, so that interval is called as lucid interval. So thus that interval is called as lucid interval. From the time of the impact and patient is quite alright for few hours or few minutes. Later he develops the symptoms of unconsciousness or etc. So those symptoms are called as those time period is called as lucid interval.